Hey friends, it's Leah with the CathCast, part of the Ally Pod. I'm joined today by the highly esteemed Dr. James Morgan, and his colleagues and friends know him as Woody. Dr. Morgan graduated from Tulane University in 2015, completed residency at Spalding, and did his fellowship at Craig Hospital. He is triple board certified in PM&R, brain injury, and spinal cord injury. Dr. Morgan began his career at Vanderbilt, and he is now treating folks at Shepherd Center. Dr. Morgan, thank you so much for joining me here today. I could not be more excited. Before we get into a few questions, do you mind just telling us a little bit about yourself?
Yeah, thanks for the intro. Thanks for having me and inviting me to come talk. My name is Woody Morgan, and I'm originally from Atlanta. I was actually a patient at the Shepherd Center. Had a spinal cord injury in 2008, so almost 18 years ago now, and was a sophomore in undergrad at the time, and was pre-med. Thought I wanted to go to med school, be an orthopedic surgeon, probably like most young athletic folks that are going into pre-med think they want to do sports medicine, and so got thrust into the rehab world and the spinal cord injury and neuro rehab as a patient. Nobody ever expects or wants to be introduced to, that side of medicine, but kind of got a firsthand experience from that, and figured I was like, I'll just go back to school and go to medical school and get a job at Shepherd, and like it would be no big deal. But then you realize all the obstacles and hurdles you got to jump through just to get through training, and then how the job opportunities at Shepherd Center do not come around that often, because people tend to stay there for years and years and years, career long.
How would you not?
Yeah. Career long stays. And so, I went to finish med school, finished undergrad, and was fortunate enough to get into Tulane. So spent 4 years down in New Orleans at Tulane University School of Medicine. Then did my intern year just in internal medicine down there in New Orleans at Ochsner, so where you're in the hospital doing all the general internal medicine things, and then specialized in physical medicine and rehabilitation at Spalding, which is a teaching hospital through Harvard, up in Boston. So spent 3 years there, where it was great. A lot of great people, but it was a little too cold for too long for
understandable
my southern blood to handle for much more than 3 years. But
I get it. I get it completely. So you mentioned you wanted to be an orthopedic doctor. Have you always wanted to be a doctor, or did this just kind of interest you later in life?
I think that was always in the back of my head. My dad, as a physician, he was an anesthesiologist, and I had neighbors and parents of friends who were physicians. And so one of the big things, I played sports all growing up, and I had numerous types of orthopedic injuries, rolled my ankle a million times, broken bones. And so I would always go down the street to my neighbor who was the orthopedic surgeon after hours and be like, I twisted my ankle at practice or broke a bone in my foot, and I need you to tell me what to do. So he would either just splint or cast me up and say, come to the office the next day. So that always those things kind of planted the seed for interest in medicine. And I always had an interest in science growing up. And so I think the combination of those things, that it was kind of felt drawn to medicine and the sciences. And so then I was, I feel like you got to start picking that early and declare first thing in freshman year of college what you're going to do, especially for medicine, because it takes a lot of, planning. You got to start from like day one, basically. So.
Absolutely.
So I thought, sports medicine to begin with, and then, life got turned upside down with the injury, and you had a lot of people telling you from the background, some to your face, some of the background of like, oh, maybe we should reconsider medical school or medicine and being a doctor in general just after this injury, because it's difficult without an injury, let alone adding on a disability and all the things that come along with that. So, but I was too stubborn one way or another to change my mind. So here we are. Yeah.
Strong-willed, you were motivated. So that kind of leads me to a few of my next points. And you mentioned this a little bit, speaking about, you do have a spinal cord injury. Would you say that your own personal experience is what led to your passion for your extensive knowledge and experience within that neurological population?
Oh, absolutely. I think going through it as a patient, you meet people going through it. They have been through, they're at rehab with you. So those kind of bonds are long lasting and strong. And I still keep up with people that were at Shepherd when I was there. And then being from Atlanta, I grew up 10 minutes from Shepherd Center, if that. And so whenever I'd come back and visit, I'd go and say hey to everybody, say hey to the therapist, say hey to, people that I remember there, and then they would always want me to come meet patients that were there just to kind of, again, do a little peer support.
Yeah.
So I think that kind of naturally progressed into it. But then, so having my own injury, the experience in the rehab hospital from the patient side, doing all the peer support stuff, so kind of all tied together. So I felt like I thought about doing lots of other types of medicine, so like internal medicine, radiology, neurology, even psychiatry. People threw that out, but I didn't have a strong, I don't know, personal attachment to those. They didn't, necessarily, I guess, speak to me, if you will, when I did the rotations. It didn't kind of grab me or have that interest that PM&R did, and working with folks with neurologic injury, just because I live that life and I've been through it and I can relate a lot. So I think having that opportunity to kind of be the physician and treat all the medical side, but also be there and say, I've gone through this, I'm going through this, I lived through this, I've been in this exact bed that you've been at Shepherd, so I think that I don't know, that speaks volumes just from the experience, personal experience, but I think I just can understand a lot of what people are going through, both emotionally but physically, and how to get back to living and troubleshooting, figure out how to overcome a lot of the stuff.
Yeah. I always say, I was an occupational therapist at a model rehab in Texas for years and years. And I always said that I learned more from my friends than I ever did from any textbook. It's the peer support, it's the community. Like, they taught me everything that I know, and like the skill set to be, a clinician. So peer support is truly key. What does it feel like to be working back at the hospital where you did your own rehab with, one of the doctors who actually cared for you during your rehab stay? Yeah,
it was pretty surreal when I first came back. It just felt, because it was always the dream job when ever since being a patient there. And so again, it was always this kind of something on a pedestal that felt far out of reach and unknown if it was going to be a possibility at some point. And it kind of came along out of the blue way earlier than in my career and life, I think, than I thought it would, just because, like I said, people stay there for such a long time. And I just kind of kept in touch and would visit and kept in touch professionally with some of the other docs that were there. And so, they would have people from Tennessee area, Nashville area that would come back and get in touch with me, either for me to see them or refer to other specialists to kind of follow up with. And I would send people from Nashville to Shepherd occasionally. So we kept up with, a couple docs. And so that was always helpful. And then I don't know, I always thought I'd leave at the drop of a hat, and things in my life were changed a little bit and evolved when this job came available. So it was a little bit harder decision than I thought it would be. But ultimately, just so glad that I was able to have that opportunity to come back and work there. And it did feel surreal. It was like a big homecoming party. The first couple days I was there, just seeing a bunch of even some of the techs that helped me out when I was on the floor, and a lot of the nurses. Some of the nurses were still there, but Dr. Murray was there. He was my inpatient doctor, so he's still working into his 80s there as consults. Dr. Lynn was one of my outpatient doctors, so now we're colleagues, and I'm consulting them for various things. So
that's wild. How, not only is it surreal for you, but I'm sure it's super surreal for them too. And just how rewarding to know that they played, a part in your life and ultimately were such a huge, significant impact in your career. And now you're working alongside them as colleagues. Yeah. Absolutely incredible. As a therapist, I would be remiss if I didn't ask if there's anything that you remember about any of your therapies while at Shepherd, whether it's PT, OT, aquatics, the good, the bad, the ugly, anything you remember.
Oh man, so many things. I think just remember, I don't know, even just getting out of bed for the first time, just it's a lot of work. And I think that's what I tell people, when we get them up for the first time, it's like, even being in your chair for as long as you can tolerate it is therapy, because it's just you're using all kinds of muscles and posture and positioning that you're not used to using. And even the ones that are working double time to kind of sit upright and be up in the chair for any length of time. So I think I remember that was exhausting, just sitting up and getting out of bed.
Yes.
I remember specifically, a couple times, first time being on the mat, my shoulders just incredibly tight. So again, just being on the mat, trying to move your shoulders around, just not working the way you want them to work, and working through some muscle pains, trying to drive the power wheelchair, and having one of my pec muscles just incredibly tight, had this big trigger point there that could not get relaxed, and so that impaired it. And so one of the therapists who's been there now for many, many years too, who I see. She comes every once in a while, but she would, her name's Patty, and so she just was like a master at manual muscle release. So she'd get her hands on you and dig into those.
Hurts so good.
Dig into those muscles. Yeah, exactly. So that's why I tell people when I see Patty working on people now, I'm like, oh yeah, I am familiar with Patty's work. So
Yeah.
it's going to hurt now, but hopefully it feels better later.
It's worth it.
Those things stick out, but then also a lot of the rec therapy. So like you mentioned, getting in the pool was pretty exciting just to be able to do that and know that that is possible. Shepherd does something called Adventure Skills Workshop in the spring, which I was able to go to as an inpatient. I tell some of the rec therapists now, and it kind of blows their mind. So I don't know if things have changed, rules have changed, or if we were going a little cowboy off the back then or not. But so yeah, you get to go, and it's at a camp in I believe Alabama, and they set up a weekend of all accessible activities, so with a bunch of therapists, inpatient, outpatient folks, and so caregivers, and do all kinds of stuff. They do wheelchair rugby, wheelchair basketball, adaptive, shooting, archery. There's like a ropes course that they get you up on. There's water activities, so both in the pool, but also on the lake, so jet skiing and water tubing, right?
Mm-hmm.
So behind the boats, those are fun.
Yeah,
tubing.
Yeah. I'm from Ohio, and now I live in Texas, so water sports aren't really common to me.
Yeah. So those things all stuck out, at least from the initial hospital stay, for sure.
Mm-hmm.
Hey, I'm Dylan from Wheelin' with Dylan.
And I'm Leah with the CathCast. If you're listening to this, you are already part of the conversation, but there's a lot more to explore inside New Motion Medical Supply's Ally program.
And all our podcasts live there too. So if you want to catch past episodes or get the earliest access to new ones, that's where to go.
And the podcast is really just one piece. Inside Ally, there's a full library of articles, webinars, and short videos focused on bladder health, catheter use, and building routines that work for you.
It's also a great place to see how others are navigating things day to day. Real setups, real experiences, and things you might not always hear in a clinical setting.
And a big part of that is the community forum. There are sub-forums for different experiences and stages of life. So whether you're just getting started or have been doing this for years, there's a space for you.
You can ask questions, share what's worked for you, or just read and see how others are handling similar situations. It's a really easy way to connect and not feel like you're figuring everything out all on your own.
And it's simple to access. If you're a New Motion Medical Supplies customer, you can log in with your My New Motion account information and start exploring right away.
It's completely free, and everything's in one place at catheters.newmotion.com/ally.
Head to the Ally program today and join the conversation.
We'll see you there.
What would you say the most meaningful part of your career is for you?
My career?
Mm-hmm. Because it's not just a job. When you really love it and it's something that's as personal as yours is, it's more of a career.
Yeah. I think some of the more meaningful things, I guess it's twofold, because I work with trainees, I work with residents and fellows, so I enjoy teaching them and trying to explain these complex diagnoses and treatment plans and physical exam maneuvers and things like that. That's just so foreign to so many people. And it's, how does that all, one, just figuring out how the body works in general is hard enough. Right. And then when you have an injury that affects that and things work differently, then it's very difficult to try to figure out, what is going on. And so trying to explain these complex topics to residents and fellows and how to kind of distill that into something that makes sense. I think it's something I'm proud of, and I think I've won a couple teaching awards, which I think proud of that as well. So that's like voted on by the residents. That means a lot. So I guess I'm doing an okay job. But
I was going to say, correct me if I'm wrong, but you were recognized as Teacher of the Year in 2023.
Yeah.
True or false?
True.
That's
I think
pretty
also
incredible.
Yes, a couple different years, but yes.
Yeah. That's amazing. So how many years did you get it?
One at Vanderbilt, my last year at Vanderbilt, and then the last 2 years here at Shepherd via the Emory residency.
Of course. That's amazing. That's so powerful. You're giving back in so many different ways.
So I think that's one of the meaningful sides of, at least from the teaching portion of it, and I just want to be, I don't know, I think remembered from the residents, one, that I taught them something, that they remember things that stuck and that they kind of carry on in their career, that they can look back and say, oh, I remember this one time, with Dr. Morgan, that this happened, we saw this, or he taught me this, so hopefully that sticks. But then I think the other aspect that's either equally, if not more rewarding, is just the patient interaction. Like, I think the peer support aspect of what I do is incredibly important to me, and just being able to relate with what people are going through. And so I do a lot of patient education as well. So we kind of talk about, honestly, a lot of the same things I teach the residents, but we teach patients, but just in a slightly different way, so they kind of understand what's the new normal, what's going on with their body, what to expect, how to manage some of this on their own, and what questions to ask once they're out of the hospital. So
yeah. How do you stay balanced separating your work and personal life, especially because the career that you've chosen is so incredibly personal to you? So how do you stay balanced?
I think there's a natural overlap a little bit, but then as you progress in your career, or at least I have, you kind of figure out how to draw that line and be like, all right, well, I'm going to turn the phone off at this point because somebody else is in the hospital and taking those, should be the primary person. I don't need to worry about this. Also, I think it's just trust with other colleagues and parts of the rehab team as well. So learning how to not micromanage all of that as much. I mean, you got to kind of have to take a bird's eye view on some of those things, and again, trust your colleagues, but also verify things are getting done correctly. So I think stepping back and again, not worrying about all the micro details a little bit, if that makes sense. No, but then I don't know, leaving work at work sometimes. I mean, it's sometimes hard to do that with any part of medicine. But leaving work there, and try to just enjoy being not Dr. Morgan outside the hospital, actually. Get over the residents that I work with, because I see them sometimes out and about in Atlanta, and they're like yelling at me across the street or something, like, Dr. Morgan. I was like, do not call me that outside of the hospital.
I know, I get it.
So I think trying to draw that line of like, I'm in the hospital, it's Dr. Morgan, but outside you can call me Woody, like just be very approachable. And I'm just, not thinking about work when I'm, out and about with friends or out to dinner and things like that. But
so when you aren't working, what occupies your time? What do you like to do for fun?
I like to stay busy. I think that was one of the things up in Boston where it was so cold for so long. Being from the South, I was used to weather like we have today, where it's February and it's sunny and 60 degrees and everybody's out and about. And so being cooped up for too long kind of in the north was not great. So I like to be busy and get out and hang out with friends. So whether it be trying new restaurants, just being outside. I love live music. So I just went to a concert on Friday, actually by myself, just so I couldn't find anyone to go with. So I was just like, I'm going to go. I don't want to miss this.
What concert did you go to?
It's a band called Clay Street Unit. They're actually from Colorado. But yeah.
Very nice. I'll have to check them out. I'm always looking for new music. So
yeah, I feel like a pretty wide range of musical interests. But yeah, I'll see. I'm still learning the venues in Atlanta. I think I got a big taste for live music when I was living in New Orleans. It's a lot lesser known bands, but just people playing, on the corners or in some of the bars and restaurants there. So there's just always good live music there. And then they have large festivals like Jazz Fest and French Quarter Fest and things like that.
Lifestyle there.
Yeah. And then moving to Nashville, so Music City.
Yeah, it was like, that's the city of music,
So then I really fine-tuned my interest and stuff. And so I was starting to go there again to things just solo, because if people were busy or couldn't find people to go with, I was like, I don't want to miss this. I was just going and trying to find tickets like almost every weekend, just because it was so easily accessible and there's so much there to take in. And so coming back to Atlanta, I'm trying to marry that love with how that fits in Atlanta, and you gotta try a little harder, but there's all to find it and kind of plan. But there's tons of places to see music. So still exploring and trying to fine tune some of those places. But
so you mentioned, you'll sometimes see your residents out and about in the community. What message would you like to share with clinicians, whether it's PT, OT, speech therapists, doctors, residents, anyone working with the neurological population? What message would you offer?
I'm sorry, I spaced out. Say that again.
You're good.
I was thinking
Working
about my
with
answer to the last question. And I was like, I talked about going to concerts by myself, but I was like, the other thing is like, I like to spend time with friends. I have lots of friends here in Atlanta.
oh well, for sure.
I feel like growing
sure.
up, I don't want to be like, I'm a loner that goes to all these
Go to
things
all
by
these
myself.
concerts.
Yes.
Even if you did, judgment free. I love doing stuff by myself.
But I guess, just going back to that. I think the other thing is spending time with friends, and that was one of the other big
Yeah.
things that moving back to Atlanta was such a unique opportunity because growing up here, I just have a large social circle of friends I've grown up with since elementary school, high school, college friends, and some now what I call kind of like adult Atlanta friends, people that I've met since moving back. So I have these like large groups of friends and kind of combining all those. So it's been nice to have that kind of social support. So
I love it. Circling back.
yeah.
What message would you like to share with clinicians, whether it's PT, OT, speech therapists, PM&R, med students, residents, anyone working with the neurological population? What message would you offer? Because you do have a very unique perspective based on personal experience and your skill set.
I guess it's, I think most people in the rehab setting understand this, but a lot of people that don't understand our patient population or work with people with disabilities, it's a lot of people make a lot of assumptions about the injury and, assume people were born with this injury and don't ask questions about, what happened or about their abilities. And so I think that's one of the biggest things is like try not to make assumptions. Everyone's got a story. I think that's one thing that, PM&R, disability, or rehab medicine teaches you is that everyone's got a story, and I think I've experienced that. And I think that's with a disability or not. Everyone's got a story, so I think that's a broader theme to take into medicine in general. And people that treat patients, regardless if it's neurologic rehab or not, is that everyone's got some sort of story, social story, or reason they got to the hospital, or things that they like to do for fun. Things we're talking about now, right? So try to unearth a lot of those things that motivate people, and the reasons that they are there, and the circumstances that kind of brought the provider and patient together, I think are important. And then so trying to understand people as people, not necessarily as patients in a diagnosis, but also trying to understand what people can do and not assume like, oh, you have this injury, then I'm gonna go ahead and rush in and do all this stuff for you. Sometimes it should be, how can I help you, or how would you like me to do this, or do you need help setting this up? Like, offering or asking how to help, I think, is more important than just trying to rush in and do things for people.
I completely agree.
Yeah.
I completely agree. I remember, as an OT, I would be working with patients, and there were so many times I would be in their room, we're doing our, morning ADL routine, and I would have to stand there like with my hands like tucked in because I part of me wanted to help. I'm in a helping profession, but it's, ultimately it's going to be beneficial to them by, giving them the opportunity to try and succeed. And, it takes time.
Yeah, that's the hardest part. I think, like you said, try not to rush in and help. I mean, that happens from whether it be therapy or from my side, teaching the residents too. Sometimes you got to, even teaching the residents, I got to bite my tongue and be quiet and let them do their thing and learn how to do some of this stuff. But,
And especially in like the neuro world, everything is so different. It's not black and white. There's no recipe book for it. You never know what you're going to get. So you really have to have an understanding that everything could just be, very, very versatile. So
yeah, and that's one of the things I think in PM&R and rehab, medicine, neurologic injuries, right there. You said there's no recipe book. There's multiple ways to do things correctly, or multiple right ways. There's some wrong ways, right? But there's a lot of other avenues that you can get to the same endpoint, the correct or a quote unquote right way. And then there's also just thinking outside the box. I think that's one of the biggest things is the creativity. It's like, how do we adapt this, or how do we make this work, or no one's ever asked this or wanted to do this before, and how do we come up with adaptations to make it work, like going to medical school. So, so I worked with the therapist, and we kind of tried to do some things and get ready to figure out what was going to be upcoming and how to adapt that and get around it. And I kind of had a little bit of, practice going back to undergrad and going to classes and just figure out how to manage my books, manage my computer, getting to and from class, managing the doors, getting in and out of the class.